So this is where we normally run the CVCs. We'll keep in this drawer the additives, and then we'll stick in our blood sample tube in here to run it. In here we have our sheath reagent and the waste disposable bottle. This is what we'll empty out into the sink whenever that gets full. We'll get a pop-up on the screen here whenever that needs to be emptied, or we'll get a pop-up whenever we need to add in a new sheath reagent. This is also the catalyst machine. So in here, this is where we stick all of these little pipette tips. Our sample cup goes in here. We'll empty out this bottom drawer right here whenever everything gets pushed out, all the slides, after the blood sample is done running, and then we'll just dump all this in the trash can. Once the blood and everything is done running, we don't need it anymore. We'll throw this tube away, as well as the blood CVC tube. So for our ELISA test, we're going to be doing a SNAP 40X that tests for the heartworms and the 5 tick-borne diseases. This is blood that we drew earlier. We are just going to centrifuge it in here. We'll do it for about 5 minutes. It usually only needs a minute or less. So we'll wait till that's done spinning. So the blood was done centrifuging, so we are going to put 4 drops of our conjugate into this little tube. And then we're going to put 3 drops of the blood into it after. I'm going to gently roll it. I don't want any cells to burst, so I'm not going to shake it. Then I'm going to pour it into this. This is the SNAP test, so we are going to wait until this is past this line right here, and then we'll snap it down. Once it's snapped, I'm going to run the test, and I'll start the timer to let me know that I have 8 minutes until the test results will be ready. So our ELISA tests results are ready to be read. So I'll click on this to enter the results. It'll bring me a list of different things to choose from. So this is what hers is showing. So that looks like it's going to be negative. So I'll click that, click OK, and then the results are automatically entered into our system. Next, I'm going to be performing a knots test. So the purpose of this is to kind of determine the difference in microfilaria. I'm going to need 1 ml of blood, 9 mLs of 2% formalin, and then a couple drops of that methylene blue. So once I mix the 2% formalin with my 1 ml of blood, the 9 mLs of formalin, I'm going to gently mix by gently inverting it, and then I'm going to centrifuge it at 1500 RPM for about 5 minutes with my counterbalance. So now that this is done centrifuging, you'll be able to see it. So we're just going to discard of this supernatant. This will just discard here. And it's just going to leave us with this result at the bottom. From here, we're going to add a drop of that methylene blue into it. And then I'm going to grab another pipette, and we're going to stir it. I'm going to grab my pipette tip and we're just going to kind of stir it around in here. So from here, I'm going to take a drop of my sample. I'm going to apply one drop onto my slide. And then I'm going to apply a cover slip onto it. And then I'm going to look at it under the microscope. So from here I'm going to be differentiating between diamitis and D. reconditium. There are a few differences to look out for. Right now I'm seeing many in numbers, more of a straight tail. The movement will be stationary if it's diamitis. Longer in width and longer in length. If it was D. reconditium, it would be shorter in width, shorter in length. The tail would be curved. There would be few in numbers. But with my results, it is showing diamitis because the length and width is long. There are many in numbers. The shape of the body is straight. And the movement is pretty stationary. It doesn't really move across the slide like it would in D. reconditium. So right now I'm going to be doing a fecal flotation. We do this because it's easier for the ova to float to the surface. Right now I've got about 2 grams of fecal in this cup that I'm going to mix with this fecal flotation solution. I am just going to mix up this fecal matter pretty good right now, and then I'm going to be straining it into my vial that I'm going to be using for the float once I'm done mixing. Now that I'm done mixing up my fecal solution, I'm going to be straining it through this sponge gauze, and then I'm going to be placing it over the vial that I'm going to be using for my fecal float, and I'm going to pour this fecal solution on top of it. I'm going to be doing this over the sink. Now that I have my end result with this fecal, I'm going to I filled the rest of the vial up with fecal flotation, and I'm going to place a cover slip onto it. I filled the vial until a meniscus formed at the top, and then I'm going to place a cover slip right on top and let that sit for about 10-15 minutes. Now that this is done reading, I'm going to carefully remove the cover slip and place it onto this glass slide here, and I'm going to examine it under the microscope. So next we're going to do a fecal flotation with centrifuge. We do this because it can recover more eggs and cysts at one time. It's pretty much the same exact steps as the regular fecal float, but we're just going to be centrifuging it this time for about 10-15 minutes. I'm going to now stick my fecal sample into the centrifuge along with the balance, checking that there's nothing else in here, and then I'm going to spin it. Now that my fecal float is ready, I'm going to once again form a meniscus at the top of this, and I'm going to apply a cover slip, and then I'm going to let it sit for about 10-15 minutes before I read it. So next I'm going to be doing a direct smear. So I'm going to be placing several drops of saline, or you can even do fecal float, onto a slide. And then I'm going to be adding an equal amount of feces on here. So I'm starting off with something that looks like this, and I'm going to mix the solution and the feces together with a wooden applicator until the solution is homogeneous. So after I'm done mixing, I'm just going to smear the solution over the slide into a thin film that is thin enough to read, and then I'll be removing any large pieces of feces as well with it. And then I'm going to be placing a cover slip on top. And then I will view it under the microscope for any eggs that I might find. Next, I'm going to be doing a sedimentation. This is usually used when suspected ova are too large to be recovered with just a standard float. So at first I'm going to be mixing about 2 grams of fecal matter with some tap water into a cup or beaker. So I'm going to mix this first, and then I'm going to strain the mixture again like previous floats with a gauze sponge, and then I'll put it in the centrifuge. Once my result has been strained, it'll look like this, and then I'm going to stick it in the centrifuge, and I'm going to spin it for about 10-15 minutes, and then I'm going to allow it to sit for a good 30 minutes after. So after my fecal sample was done with the centrifuge, I'm going to grab a pipette, and I'm going to pipette off all of this excess liquid without disturbing any of the sediment on the bottom, and then I'm going to use a pipette to transfer the sediment on the bottom onto a microscope. So I'm just going to take all this liquid out. And then I'm going to grab part of the sediment down here. I'm going to place it onto my slide. And then I'm going to apply a cover slip to it afterwards. And then it's ready to be examined under the microscope. So we did this fungal testing because our patient started losing some hair kind of on both sides of her face, and it was very crusty, but she wasn't very itchy, and the owner had read up about ringworm and wanted us to test for it. So that is what we're testing for today. We chose to do this by plucking the hairs from that area. There are also different other ways for fungal testing, like culturing bacteria and looking for colonies, but we chose to do the hair plucking as our fungal testing today. So now for my fungal testing with the hairs that I plucked. The fungal testing is going to be a dermaphyte testing, which is also known as ringworm. That's what we're going to be checking for with this dog. So I'm going to take the plucked hairs from the suspected lesion that I took, and I'm going to be placing it onto my slide, and I'm going to put at least 1 to 2 drops of clearing solution on it. After that, I'm going to place a cover glass onto it. I'm going to wait about 2 to 10 minutes, and then we're going to be looking for some small globular arthrospores that will become visible if it's a positive test. So I'm going to be looking at our sample under the microscope. We'll be looking for something that they're called small globular arthrospores, and they become visible if it's a positive test. It almost looks like they're like little circles on the outside of the strands of hair. And it does not look like that is showing up for these couple of strands. So I'm going to have to say that this fungal test is negative. So we did this skin scraping on this patient today because the patient was having really crusty, scaly skin, was losing a lot of its hair, was very itchy, wasn't a food allergy, was a younger dog, but it was losing hair, and it did not have any history of allergy issues. So when I scraped the dog, I scraped towards me, and I keep going until the skin kind of looks like it's getting red and irritated, just until it starts to bleed a little bit. That's how you know you went deep enough. So after I got my sample, I put it onto my slide, and then I'm going to view it under the microscope to see what I find. Okay, there you go. See the blood on the... Sorry, I'm not very good at this focus thing. Okay. There it is. So now I'm going to look at my slide underneath the microscope. I'm mainly looking for things like mites, like mange, scabies, and any type of fungal infections as well. Because my patient has been losing some hair and has been itchy and a little flaky, so you just want to rule out any kind of mites or infection. And from this sample that I have gotten, I'm not seeing any indications of any kinds of mites or fungal infection. Before getting started on our necropsy, we're going to want to wear some protective gear. So we'll have a gown that we'll wear that covers our whole body. We'll have a face mask to wear, and then as well as gloves.
Okay, I'm starting now.
Alright, let me have the scissor over there. So we're opening up the abdomen, and we're going to open up the chest as well. Don't know it's big. So this is subcutaneous fat. Let's open it up a little bit more. So this is spleen. This dog died of lymphoma. So you have your histopatch, right?
Mm-hmm.
And these are probably all little spots of lymphoma. Won't know for sure until histopath. This is omentum. This is the stomach, which you got to eat a breakfast. There's lots of food in that. Again, omentum. Small intestine. Amounts of gas in here. This is colon. So you can follow the colon all the way around. Goes to the cecum. And wow. That is a gigantic mesenteric lymph node. More evidence of lymphoma. This whole thing. That's massive. It should be about that big. Because here's cecum. And then it goes to everything's a little bit. Wow, these are huge. So then it goes to ileum and jejunum. So you can follow the whole loop of bowel. All the way down to here, which then is the duodenum. Which does not feel normal at all. And that goes up into the stomach. I mean, look at that. Here's pancreas. Here's the right kidney, if you can see that. There's a big old vena cava. And then here's your left kidney. And bladder is empty because it went all over Caitlin. Right here, teeny tiny bladder. So that's everything besides the liver right here. So really that's probably good enough. Okay, so here's your diaphragm. It's that layer of muscle. So now we got better access to the liver, which is big, rounded, from lymphoma. And then here's our heart. And here's our lungs. The lungs are just the coolest thing. It's like a sponge. Lungs don't look bad. Heart. Open the pericardial sac. And amazingly, not seeing obvious changes in lymph nodes there. Alright, you want your biopsy?
Yeah.
So we'll take a sample of liver. And then sample of spleen. That's it.
Hello. So here we have the biopsy jars. We have the name of the patient, the date that we collected the sample from, the name of the sample that we collected, and the doctor's name on here as well as their date of birth. Just kind of a close-up. So for rabies suspect handling, I live in the state of Texas, and here they require very specific labeling. They require the suspect to be shipped off in a leak-proof container with some watertight material and absorbent material between each layer of that. For rabies who can handle, they try to limit the amount of staff that can handle this patient, so it would be restricted more towards the veterinarian or the technicians. Protective gear you can wear would be face masks, possible eyewear, gloves, aprons, closed-toed shoes, things like that. The remainder of the body is disposed also in watertight, absorbable material that is sent to crematory. They will cremate and dispose of the rest of the body. So for my vaginal cytology, I'm going to need to clean the vulva with Chlorohex. Also going to need to clean it off with a little bit of alcohol as well. So here is the sterile swab I'm going to use and my saline, and I'm just going to moisten this sterile swab with my saline. I'm just going to drop a couple drops on here just to moisten it up a little bit. So when inserting the sterile swab into the vagina, I'm going to advance nearly vertically first, and then I'm going to insert horizontally, and I'm going to gently roll the Just going to grab my sample, and I'm just going to smear it like this onto my slide. And then I'm going to take it to the microscope to determine what stage of estrus my patient is in. So now I'm looking at my sample under the microscope, determining what stage of estrus we are in. There was no vulva swelling at the beginning, so that helps give us an idea of what we can find. If there's no vulva swelling, then there's a possibility it could be anestrus because she wouldn't be attracting any male dogs at the moment. My guess would be that she is anestrus because there are no non-cornified squamous epithelial cells, which are those are very large cells with a large nucleus, and it's a very large rounded nucleus. And because of the non-vulva swelling, I could probably say that this patient is in the anestrus stage of estrus. So for our cross-matching, our first step is to divide the animal's blood that's being tested on into a serum separator tube and a lavender top tube, which I did already and labeled donor for the lavender and the red top, and recipient for the lavender and the red top. So after I centrifuged my blood sample, I'm going to decant all the plasma from each of the lavender top tubes. Once I've done that, I'm going to add 2 drops of blood, 1 to 2 drops, in a disposable glass tube that I have right here. And then I'm going to fill the rest of this test tube with sodium chloride. After I've done adding the sodium chloride, I am going to centrifuge for about a minute at 3400 RPM. And then I'm going to decant the supernatant after that, and I'm going to repeat this step about 2 more times. After I finish centrifuging this, the supernatant should be clear and colorless, letting us know that the erythrocytes were thoroughly washed. After I'm done washing this, I'm going to make a 2% erythrocyte suspension by placing 0.02 mLs of this, of the packed washed erythrocytes in a test tube, along with 0.98 mLs of saline. So now I'm going to place 2 drops of the recipient's serum and 2 drops of the recipient's erythrocyte suspension that I made here into a new test tube. In a second test tube, I'm going to place 2 drops of the donor serum and 2 drops of the recipient's erythrocyte suspension into another test tube. To check for auto-agglutination, I'm going to set up controls by labeling these tubes as controls, mixing 2 drops each of the donor cells with its own serum in one tube and the recipient cells with its own serum in the other. So I placed all of my tubes in a rack now, and I'm going to shake it gently to mix it. After doing this, I'm going to incubate it at room temperature for about half an hour, and then I'm going to centrifuge all of the tubes for a minute at 3400 RPM. So now I'm going to check to see if any agglutination is observed. So I'm going to take one of my samples. I'm going to put a drop of it on my slide and place a cover slip on top of that. If no agglutination is present, the erythrocytes would be evenly dispersed. If it is present, they'll be seen as grape-like clusters. So I'm just going to lower the So any significant hemolysis and agglutination in one or both of the cross-matched tubes would mean that the transfusion would be incompatible to take place. So there's no agglutination in this sample so far. All the erythrocytes are pretty evenly dispersed. There was no hemolysis either. So it looks like this sample would be a good sample, a compatible sample for a transfusion.